I'm Mike McConnell. Welcome to the podcast version of the Medical Minute. And guest this time out is going to be a primary care physician. Dr. Jonathan Buck is joining me. And among other things, just trying to get people to the doctor, and in particular men, I would guess. First of all, Dr. Buck, good to have you here. Thanks for your time.
Yeah, thanks very much. Nice to be here.
Are men far more reluctant to see a doctor, well, a primary care physician, number one? I mean, they probably, when things go wrong, they probably then go to the doctor. But as far as ongoing health maintenance, are they less likely to go?
Yeah, I mean, it depends on the guy. It depends on what kind of situations you have. But in my experience, the old adage is just ask their wife. You know, if someone comes in, it's usually because we get the story of, I'm fine, I haven't been to the doctor in a long time, my wife's making me come, you know, that sort of thing. And then we'll typically find a few things that we need to address. But
so if somebody hasn't been to the doctor for a long time, I know talking to my dentist, I was surprised to find out only 50% of Americans go to the dentist. So I don't know what percentage of men see the doctor on a regular basis, but it might be a similar number. I don't know. So if somebody hasn't been there for a long time, how do you talk them into coming in?
Yeah, I mean, I typically just try and relate to them and find a common interest point. You know, guys, you know, a lot of times take pride in certain things they own. For instance, some guys really like their cars. You know, they'll be out, especially in nice weather, minus a cicada or two flying at you, but they'll be washing and waxing their car and topping up the fluids and making sure it's, you know, humming like a top, and your body's the same way. I mean, if you don't take care of it and don't go in for regular oil changes, so to speak, and kick the tires every now and then, you know, you might be left on the side of the road stranded, and that's certainly not something we want to do, especially as we get a little bit older, you know, with, you know, lifestyle, you know, changes and things of that nature. We want to make sure that we're running smooth and not running into any issues.
There are different screenings along the way that the men should have at certain ages. Give me an example of a few.
Yeah, I mean, there's been a little bit of shakeup on the age screening. Most guys kind of fear the old dreaded colonoscopy or the prostate cancer screening test. Usually, guys have the kind of an older viewpoint on that. Things have changed a little bit. 50 used to be kind of the general cutoff for a lot of things, but it's very individualized. If you have significant family history or if you have any symptoms of anything, then, you know, screening may take place much sooner than that age, and that's why it's important to discuss all those things. And even if you forget, it's my job to kind of ask you about that.
Sure.
But certain things, for instance, colonoscopy, recently there's been a recommendation to start doing that at the age of 45. It used to be 50. Now, this is for average risk, no family history, to do that. And most guys, you know, honestly, just explaining the procedure is half the battle, because people, you know, don't really know what takes place in a colonoscopy, how it is. Will it hurt? Will they remember it? You know, we don't want to have PTSD after a procedure, that's for sure. But the procedure is relatively benign. There are risks, as there are with every procedure we do, just like any medication you take. But we have an excellent group of GI doctors that do that, and what we like to do is, you know, bring you in and talk to you about that and explain the procedure to you, just so you're armed with a little bit more information and kind of settle also your nerves a little bit.
Yeah.
Really, the night before is kind of the issue for a lot of people, because you got to clear your schedule. If you do the prep the best way that's recommended, the whole idea is to make yourself squeaky clean. That way the doctor can see every little nook and cranny in there and make sure there's nothing hiding, nothing kind of slow growing that they might miss if the prep is suboptimal, because then we might have to bring you back a little bit sooner.
Well, and I've told people, and I've had a colonoscopy, the post-op is fun, the most relaxing day you might ever have.
Exactly.
If you get that done in the morning and you're home by, 10, 11 o'clock in the morning, you're just going to relax and doze off and on all afternoon and feel like $1 million. So.
Yeah, and then the whole idea is the better you do with the preparation, and if the doc can see everything great, and if there's no concerning findings, it's a once in 10-year type exam, which isn't too bad. And if there are some findings, they'll talk to you about that, and they'll bring you back based on the recommendations, based on the types of things they find.
Right. Well, then, if you find an issue with somebody who comes to see you, let's say it's a heart condition, whatever, you could then partner with other TriHealth physicians to treat that patient.
Yeah, absolutely. I mean, we have a very, very robust group of specialists all across the field. And it's my job as a primary care doc. I'm kind of like the quarterback. I'd like to think of myself as Tom Brady, depending on where you are, but I don't know if I have that many championships. But it's my job to know a lot of different folks in a lot of different specialties and have good relationships with them. So if you come in and you're feeling, let's say, maybe some chest pressure or you have a little shortness of breath and I think it's a cardiac issue and we get you tested or worked up, I do know personally some excellent cardiologists to send you to and can vouch for them, and we get you plugged in straight away. It's not something where, if I'm concerned about something, the whole idea about your primary care doctor is that we'll get you in quickly. It's not going to be where you call and they'll say see you in 6 months. If there's a concerning thing, I'll be able to get you seen tomorrow.
All right. Aside from your annual checkup, there are other ways to see your doctor because, e-visits, I think, since the world of COVID came along, I would think e-visits and e-medicine are going to be increasingly common.
Yeah, it's a great tool. There's certain things, obviously, we can't do. I can't physically lay hands on you or examine you or listen to your heart in case I'm concerned about something like that. But wonderful tool for people, especially busy people, if you need to talk about anything or even, you're out, doing some yard work and you get a rash and you're not sure if it's poison ivy. I could see that through an e-visit or something along those lines. But the other thing is, especially with guys, mental health is a big topic, and it's something that we can certainly discuss via, a video or telephone visit. And there's, I think, far less of a stigma associated with that these days, and it's definitely something that affects all people. It's not just unique to certain ages or certain genders.
Sure. Speaking again with Dr. Jonathan Buck, who's a TriHealth primary care physician, and TriHealth is a healthcare system. How would you explain what that means?
Yeah, well, basically, primary care is kind of where most things start. You see us for sick visits and for any complaints, but, you also want to see your primary care doctor for your annual wellness visits. It's important to have those screening tools take place to make sure that we catch things early. For instance, we talked earlier about colonoscopy. Prostate cancer screening is a big one. I tell most of the guys, there used to be the old drop them and turn around, and most guys' blood pressure shoots through the roof, but
right.
Nowadays it's actually a blood test that can be done that's pretty recommended. Now, if you're of average risk and you're not having any symptoms, we can just check markers in the blood for the most part, so that usually settles kind of the old heart rate down for a lot of guys. But it's important to get in and get screened. But from seeing me, if there's any concerns, like I said, if we need to send you to see a surgeon or a heart specialist or a lung doctor or anything like that, this whole system has all those physicians capable. The nice thing is too, all of your records, it's a one-stop shop. So any scans, or if I'm concerned and I want to get an image of your chest, or the lung doctor sees you and puts you through some tests, I get all those reports and they all get sent to me. So it's very easy to keep tabs on everybody and know what's going on. You don't get lost in the shuffle by being a part of a system like we are.
Sure. We've been talking about vaccines, seems like incessantly for the past 6 months. Media attention on vaccines brings us to the point that there are other vaccines adults should be getting. And give me some examples of what vaccines we should be getting at what ages.
Yeah, so there's obviously, we strongly encourage COVID vaccines, and we've had a good turnout on that. Hopefully we're kind of getting back to norm on that slowly with the vaccination process. But there are other vaccines. Some are age-related, a lot of them. For instance, kind of using the age of 50 again, it's kind of a shingles vaccine is recommended for a lot of folks. Most people know shingles. It's pretty uncomfortable. It's kind of a reactivation of sort of the old chickenpox sort of virus that lives dormant in you for many years, and it flares up when we're stressed or a little bit older or maybe sicker.
I've heard it's pretty painful.
It's quite painful, yeah. And for the most top part, it's very well treated, and depending on where it is on your body, but there can be certain concerns. You can get it kind of on your head or near your eye, and that's obviously much more concerning than if you got it on your backside or something like that.
Right.
But the vaccine is recommended at the age of 50. it's an excellent vaccine. As far as vaccines go, having data that says 90 plus effectiveness is pretty impressive in the world of vaccines. And the shingles or Shingrix vaccine is one of those that's quite good. We also recommend pneumonia series. Now, these pneumonia series are usually for patients 65 and older, and those are to prevent against the most common types of bacterial pneumonias. Now, that's different from COVID. COVID's a virus, but these are to prevent against bacterial pneumonias. But we also do those pneumonia shots at earlier times based on chronic conditions. So, for instance, if you had diabetes or you were a smoker or you had asthma or even chronic kidney disease, there's certain indications to do vaccines at earlier ages, and that's why it's very important to follow up with your primary care doctor, because we address all of that during your annual visits.
Sure. All right, then we have stress to deal with, and some would say the pandemic increases stress levels on a lot of people. As a primary care doc, what, if anything, can you do to somebody who's simply stressed, anxious, or just kind of down as a result of COVID?
Yeah, we've seen a huge uptick in mental health issues over this past, year and a half or so, and that's, human beings aren't just, natural to be isolated and locked in. And while we were all trying to do our part, it does take a toll on you, and since we're all talking about kind of the male focus here as far as getting fellas in to see the doctor, I mean, a lot of guys, it's relationship aspect. If you feel comfortable with your doctor, you feel more open to talk about those types of issues as far as anxiety or maybe some bouts of depression. And it's important for us to assess that at each visit, because sometimes that stuff sneaks up on you. It doesn't all present in one big episode. That it could just be slowly, where as the doctor gets to know you, you say hey, you seem a little bit off your game, not the normal, happy-go-lucky self that you are, and it's my job to kind of figure that out as I get to know you and build a relationship with you. Like I said earlier, it's not as stigmatized these days to talk about that, and we have a lot of treatment options. Some are medications, but counseling is a fantastic way of working through these things, whether it be with a licensed therapist, or if medications are needed, a psychiatrist perhaps. But your primary care doctor can usually manage a lot of that as well, so it's important to talk about.
All right. And we have rules change. You don't. In the healthcare system, my guess is they'll be among the last places to waive the mask requirement. Why do you see it as important in your office?
Yeah, I mean, the big thing is, not everybody knows. There's a lot of fear, I suppose, and not everybody knows why someone else is sitting in the medical office. Is it here for just your checkup and you're fully vaccinated, or maybe perhaps you didn't get a vaccine for whatever personal reason, and are you currently ill with something, or what if you're undergoing active chemotherapy treatment and you're immunocompromised? So, we want to be respectful to all our patients, and we want to make sure that we're not causing any harm, of course, by having them wait in a waiting room. So from a masking policy, we'll probably stay pretty vigilant here at TriHealth to protect our patients, because that's our number one goal. As far as down the road, we're just kind of following CDC guidelines and recommendations and pivoting as we can. We've certainly prided ourselves during the pandemic of doing a great job of mitigating the risk. We were doing sort of what we called expedited visits, where you'd call ahead and stay in your car. That way we wouldn't have you waiting in the waiting room and potentially catch something. But I can tell you anecdotally, I mean, I've seen far less cases of influenza this year, which was a big concern, and that's just because of the mask wearing in the community. So it's certainly something, as physicians, going forward, we'll probably wear masks a little bit more regularly during those cold and flu seasons, just to prevent ourselves and our staff and everybody else getting sick, and certainly wouldn't want to go from one patient to the next and spread something to somebody else as well.
Yeah, less flu and fewer colds this entire season. Well, listen, I appreciate your time. Dr. Jonathan Buck has been my guest, a TriHealth primary care physician. And to learn more, you can just visit TriHealth.com/primary care, TriHealth.com/primary care. Dr. Buck, thanks again for your time and expertise. We'll talk to you down the road.
Anytime. Thanks so much for having me.
And thanks for checking out the TriHealth Medical Minute from 700WLW.com.